Welcome, dear doctors and distinguished panelists, to this novel webinar that we are conducting on ABDM and DHIS. We are thrilled to see so much of an excitement, especially from the doctor community, on the DHIS and ABDM initiatives. We at Eka Care are super committed towards this initiative by Government of India. You can see this from our overall numbers as well, as we are the largest private player to link care context, be it on the PHR side, which is our patient application, or the EMR that some of you would love to experience. What we feel today by looking at this excitement around the doctor community as well as with the patient, where more than 5 lakh patients last month have linked one or more care context with ABDM, is that ABDM now, which is Ayushman Bharat Digital Mission, has started seeing a large reach, adoptability, and more important, acceptability across all the various stakeholders. We have also seen there is an excitement with insurance agencies as well as with other healthcare providers. What we feel about this platform as it comes along is this is practically a UPI moment in healthcare. The way UPI has changed the way we transact with people, be it a shopkeeper or a peer-to-peer transaction. In the same way, ABDM and NHA with this platform will create a disruptive ecosystem where the digitization of records will open up many opportunities for all of us. It would make sure that the healthcare is far more discoverable. It will ensure that the control of your medical records, your patients is all with you. There are 3 key areas that we feel are completely groundbreaking in this DPI, which is Digital Public Infrastructure, very similar to UPI. The 3 key pillars that we are super excited about as a technology is, number 1, the whole architecture of fragmented data sharing. Now this means that the entire data is quite private, quite secure, and is fragmented across the data sources where it should be kept. The other very important pillar in this architecture is interoperability. Now, interoperability is so important for any kind of large digital public infrastructure, as interoperability will improve the experience for the patients and doctors in this case. It will also make sure that the switching cost from one platform to the other platform for users such as yourself is absolutely zero. Also on the other side, it will make the private innovators such as us to keep pushing for better and better product experiences. Last but not the least, which we are super excited for in this entire architecture, is the consent framework at the heart of it. And that allows, be it patients or doctors or healthcare providers, to keep complete control of their data. The consent are very granular and will ensure that any data that is shared across this network is completely in control with the owner of that data, be it a patient or a doctor or any other healthcare provider. With this, the cherry on top is the DHIS scheme that we will talk about in this webinar. The incentive scheme is to ensure we see a widespread adoption of this platform and the digitization of entire ecosystem. At Eka, we feel that we can contribute towards this digitization by riding on this wave of Ayushman Bharat Digital Mission and by connecting with patients and doctors such as you all. Looking forward to work with you all and sharing more as we go along. Thank you so much.
So we'll begin the webinar with our first session, Introduction to ABDM and DHIS by Dr. Neelesh sir. He's a senior consultant and a diabetologist from Noida with more than 18 years of experience in the clinical field. He's the founding team member at Eka and heads the medical affairs here. He has integrated digital solutions right from the early days of ABDM and DHIS. Thank you, sir, for joining us. Over to you to give us the first introduction to ABDM and DHIS.
Thanks a lot. Thank you, Dr. and Dr. Preeti. Very warm welcome to all the audiences, my colleagues and fellows, and esteemed panelists, Dr. Piyush and Dr. Pankaj. A warm welcome to all of you. So friends, today we have gathered for this webinar to understand what is Ayushman Bharat Digital Mission and how the government is trying to incentivize the digitization of the health ecosystem in this country. And please remember, please note, it's not only about doctors, it's about all the stakeholders. It's about hospitals, it's about labs, it's about any stakeholder who is active in the field of health in India, and that's how the government of India is going to proceed. So let me start with my presentation. To begin with, we need to understand first why do we need digitization of healthcare in India? The reason is that there are disparate entities in the ecosystem that demand patients to approach multiple players individually. We have a very large population with complicated and inequitable distribution of healthcare resources. There are multiple programs and distribution for enrollment and availing benefits. There is obviously a difficulty in maintaining paper-based longitudinal records. There are long wait times for insurance resolution and high overhead costs lead to high premiums. And obviously, there's a reactive approach to health management with low emphasis on prevention. I would request all to please go on mute so that those who are here can listen the speaker speak. So basically, the government of India came up with this Ayushman Bharat Digital Mission strategy, which was inaugurated by Honorable Prime Minister Shri Narendra Modi, 27 September 2021. And it aims to develop the backbone necessary to support the integrated digital health ecosystem of the country and also ensure a seamless exchange of health records, enhancing quality of care, efficiency, accessibility, and affordability. So, what are the key components of this program? So, there is a tech backbone with healthcare professionals and doctors, nurses, paramedics, labs, technicians. So, which includes all the healthcare professionals at one end, individual patients at the receiving end, health facilities as a service provider end, and between them, the tech interface using HMIS, EMR, LMIS, PHR apps, consumer health apps, doctor apps, and then obviously the three pillars, broad pillars, the HPR, health professional system, ABHA ID, the HFR, facility registry. Then there's a concept manager over this basic structure that will make the universal health interface and health exchange possible. So what is ABHA? So ABHA basically stands for Ayushman Bharat Health Accounts. It's a 14-digit unique health identifier which records health transactions and help build health history. It links an individual's health records across health facilities and healthcare professionals, allows the individual to exchange the same health records across the ecosystem. So to give you a sneak peek, in future when a patient will go to any health facility, it can be a government, it can be a private, it can be a clinic, he will go with the same health ID and his records will be visible across the spectrum. What is ABHA address? ABHA address is either user-generated default address in the format of XYZ@ABDM. It is easy to remember. And how ABHA works? ABHA supports linking of health records to an individual and supports identifying and exchanging information seamlessly. What is the second component is HFR, Health Facility Registry. It is again a 12-digit unique ID called as Facility ID issued by the registering HFR. HFR lists and facilitates the exchange of standardized data of both public and private health facilities. So it is important to note here that the transfer of data or the interoperability will be across the spectrum. It will not be restricted to either the government or the private. What is the third pillar? That is a health professional registry, a comprehensive repository of registered and verified healthcare professionals across all systems of medicine, a 14-digit unique health ID called as Healthcare Professionals ID. It will be allotted to professionals registering in HPR. HPR will enable healthcare professionals to get connected to India's digital health ecosystem. Now, how will this effectively change the way people behave today? So suppose there is a patient named Rani who is around 28 years old who has an ABHA ID. And she has a longitudinal health record journey from RCH programs in pregnancy tracking to there was another case of malaria on different date. Then there was a visit to a government hospital. Then there was a COVID vaccination administration date. And then there is a visit to a private hospital as well. So all these records, they become tagged to this health ID. And as a doctor sitting in my clinic, if the same patient comes to me, I will be able to visualize this whole health journey on a single screen. And as you can see, this health journey encapsulates or captures the spectrum of both the frontline health workers like Asha and Anganwadi, the nurses at a government institute, and the doctors at both private and government setting. So now the government is saying that we want to make this more attractive to the healthcare providers or the stakeholders. For that, they have earmarked a capital expenditure of around 1,600 crores per annum in the program for different components. And one of the very interesting component is digital health incentive scheme, where one health facility, which is a clinic, can earn incentive up to rupees 4 crore per annum. So what are the eligibility criteria for digital health incentive scheme? At the health facility level, all encompassing eligibility extends to healthcare providers at various levels, including clinics, nursing homes, and hospitals. This inclusion ensures that facilities catering to diverse healthcare needs from primary care to specialized treatments can participate and benefit from DHIS. Lab, radiology, diagnostic centers, and pharmacies. In addition to the traditional health facilities, even diagnostic centers specializing in laboratory and radiology services as well as pharmacies are eligible, recognizing the integrated role of diagnostic services and pharmacies in the healthcare ecosystem. This inclusion ensures a holistic approach to digital health adoption. So, what are the benefits of ABDM to doctors? First, number one, improved discoverability and visibility of healthcare professionals, enhancing the doctor's practice. Access to view patients' health history with their consent in a safe, secure, and cost-efficient manner. Ready and complete availability of health records will help the caregiver in making good clinical decisions and better quality of care for the patient. They will be able to engage with more patients through both in-person and teleconsultation. It will save administrative costs and time in the long run. Availability of single platform for council registrations, renewal, practice license, etc. So the government wants the doctors to go digital. Even the NMC ethics guidelines which came up, although it was rolled back, but they stipulated that from the date of publication of Gazette notification, the doctors will have to go digital within the next 3 years. So we should look at all these developments not in isolation, but as part of the similar thread that the government of India is pursuing, trying to cajole or trying to nudge doctors to go digital for the benefit of their patients and the whole health ecosystem. I would like to end this introduction with one most common myth that doctors have, that maybe the government wants to track the overall business of a doctor or the hospital. So, my friends, I would like to burst this myth here itself, that ABDM cannot track the overall business of a doctor or hospital. In fact, government cannot track the number of patients you have met. The government cannot track the fee charge. The government cannot track the treatment offered at an individual level. The whole data, the whole patient data is stored in disaggregated cloud servers spread across the country, and government can only access the data at an aggregate level, and there is no scope for anybody, not only the government, anybody to access the data at an individual level. The whole data has to be encrypted, securely covered under the standards prescribed by ABDM, and it follows 256-bit highest possible data security standards. And any technological firm or any technology company which wants to be compliant to ABDM has to be compliant to all these norms and regulations being brought in by the government of India. Thank you, my friends. Thank you, Dr. Sanjana. Over to you guys.
Thank you, sir. I think that point was essential to clarify that the data privacy is always intact in spite of ABDM. So we have a small introduction video around the same thing, because Eka Care has been in the space for I think for a very long time. It's just a 2-minute video, and then we'll move on to our next session by our esteemed guests, Dr. Pankaj sir and Dr. Piyush sir.
Hi, I'm Dr. Sanjana.
Hello doctors, I'm Dr. Preeti.
Hello friends, my name is Dr. Nilesh Kapoor.
Hi, my name is Amit Bharti, founding team member at Eka Care. Eka Care is India's fastest growing ABDM approved PHR and HMIS solution. We are amongst the early adopters in private player space who integrated with ABDM and have been the top private player driving the ABDM adoption. To further increase the ABDM adoption, NHA announced Digital Health Incentive Scheme or DHIS in early 2023, and that has been the biggest driver in increasing private doctor adoption to HMIS solutions.
And within this scheme, the government is offering digital health incentives for doctors to go digital.
What are the benefits of the DHIS schemes?
By participating, you can A. Earn incentives. Every step that you take towards digitizing your practice enables you to earn incentives which can range up to 2 lakh rupees per month via the Government of India scheme of DHIS.
Second, we get to ensure seamless journeys for our patients, right from registration to linking of their medical records to creation of their ABA.
C. Enhanced digital practice. DHIS empowers you to digitize your practice, and this is where Eka Care steps in. Now, let's talk about Eka, my digital ally in earning incentives through DHIS. Earlier, I was considering it a complicated task, but Eka tool, which is ABDM enabled, has streamlined the entire process from registering the HPR, HFR to fully digitizing my practice through EMR.
The most important thing, Eka Care has a patient side which allows them to create these ABA accounts or ABA numbers and digitize their medical records. So you get to see their medical records easily on your tool as well.
So just reach out to your Eka Care representative to understand the next steps. Happy practicing and best wishes.
We will move on to our next session, and here I would like to welcome Dr. Piyush Desai, sir, who has been with us, Eka Care, since a really long time. He is a practicing endocrinologist in Surat with more than 15 years of experience and a regular faculty speaker at various national and regional academic forums. When it comes to seamlessly leveraging and marrying tech with medicine, Sir is second to none. And he has not only been a constant mentor for Eka Care, but also successfully integrated ABDM in his day-to-day practice. Over to you, sir. We would like to hear your experience and learnings on the ABDM and DHIS platforms.
Yeah, thank you. Thank you for inviting me for this session also. First of all, I will say before I discuss or I tell anything about DHIS scheme or whatever Dr. Nilesh Kapoor has added, this is the era of digitalization. Years back, we were doing everything on paper, and now we have moved on data what we are keeping in our mobile. We are not even using our laptop many times. We are keeping our all records on laptop or our iPhone or Android phone, and we are just even our UHID that is generated for Aadhaar ID. We are not using having Aadhaar card. Many times we are showing with e-wallet. So why our patient will come and show you the data which are only available on paper? Secondly, as a diabetologist, as an endocrinologist, many a times it happens that we want to see patient's history over the period of years, and that led me to use of digitalization almost 4-5 years back. And for last 1.5 to 2 years, I am with on Eka Care platform and also attached to this this ABDM thing. One thing I would like to share that if we have patients who are coming to us with all the possible medical records, it is easier to see in a single window rather than seeing all 4, 5, 7, 8, 10 files, because that is very common in diabetologist and endocrinologist practice. And we cannot go through all the data. We have to find out the relevant data from there. So if patient is a unique ID and all data, that is good. Second thing, many times our endocrine patient with pituitary problem or pituitary surgery, they don't have data. Actually, they have been gone through which type of surgery they have been operated. So if everything is on single platform, it is always better for us to judge that patient properly and deliver the best treatment, best possible treatment for that particular patient. Initially, I was a bit skeptical about using this ABDM and everything because I was, Eka Care people know that my OPD is always remaining busy. So I was not getting time that who will explain everything. So I take help from them. They put a few board that which I kept on my clinic, and I trained one of my staff to do all these things because now it is very easy. Just a single click and a single verification, patient can register themselves from ABDM. So it is very easy. So many patients are ready with that. Similarly, with the app they are having, they can upload data, they can upload the reports. Even I can upload report from my side, and that is visible to both the way. My reports or whatever my prescription or whatever things happen in my clinic is visible to that particular patient, as well as if patient has gone through another records or blood reports in between, that is also available. If just they have to take a screenshot and they have to upload it into the app. So this is very easy to track down medical records, and I feel over the period of time, this is especially in a chamber like endocrinologist or physician, I think this data is something which is most important thing for us, because that is not only for our routine day-to-day practice, but in future how the things are going out. If particular medicine, how this particular medicine is working out in your clinic, in your experience, if you want to find out, these are the data what we can utilize for. So this is not only for easy way to practice, but this is for making or building up a better future.
Definitely, sir. I don't think anyone else could have summed up their experience and the advantages like you did. And like you rightly said, getting this data and how it's going to benefit us 10x in future is something all of us are looking forward to.
will introduce our next panelist, Dr. Pankaj Kumar Yadav. Sir is an orthopedician practicing in Patna for more than 15 years. And he has been, his main patient base comes from the lower socioeconomic classes. And he has been a pioneer in close collaboration with government and its projects. Not only has his hospital been the first hospital in Bihar to get a NABH certification, but he's also the first private hospital to start generating digital health records of patients under ABDM scheme. Sir, a warm welcome to you. We please would like to hear what is your experience about onboarding on Eka to use the ABDM and the whole scheme, and maybe if you have certain cons or certain points where things can be smoothened out further, we would like to hear that too. Please, sir.
थैंक यू मैडम फॉर योर काइंड इंट्रोडक्शन। मैं बिहार में पटना से ऑलमोस्ट 70 किलोमीटर्स अवे एक रूरल टाउन में रहता हूँ और शुरू से डिजिटल जो भी गवर्नमेंट के ये पॉलिसीज चेंज होते रहे एनएचए के बनने के बाद या एनएमसी के चेंज होने के बाद, तो बहुत सारे चेंज हो रहे हैं, तो उस पर क्लोजली वॉच कर रहा था मैं। और मीनवाइल मैंने बहुत सारा ट्रायल कर रहा था एबीडीएम के पार्टनर्स के लिस्ट में। रोज मैं देखता था कि कौन नया चीज लेकर आया है, कौन अच्छा सॉफ्टवेयर होगा जो इसके साथ अटैच होगा। मैंने बहुत सारा सर्च किया, बहुत का डेमो लिया, ट्रायल किया, लेकिन फाइनली इका पर मैंने फोकस किया। और जब इका के साथ हुआ तो सबसे बड़ा कि इसका इजीली हैंडलिंग जो इसका है सॉफ्टवेयर का बहुत इजी है। सिंगल क्लिक पर आप लॉग इन कर जाएंगे, सिंगल क्लिक पर आभा कार्ड क्रिएट आभा हो जाएगा। तो ये सब चीजें सिंगल क्लिक पर जैसे ही आप प्रेस्क्रिप्शन अपना डिजिटल प्रेस्क्रिप्शन कंप्लीट करेंगे वो ऑटोमेटिक अपलोड हो जाएगा और एबीडीएम पर अपलोड हो जाएगा। ये बड़ा चीज था। और उसी तरह से उसका प्रेस्क्रिप्शन का डिजिटल कॉपी पेशेंट के पास तुरंत चला गया। ये सब छोटी छोटी चीजें हैं जो कि एक सॉफ्टवेयर के नाते इन लोगों ने अच्छा डेवलप किया है। रह गई बात DHIS के लिए। DHIS के लिए मैंने बहुत कलीग्स से बात की, तो कलीग्स का प्रॉब्लम है कि हम लोग के लाइफ में नहीं होगा, ये मोदी सरकार का है, अभी संभव नहीं है, ये हम लोग के नेक्स्ट जनरेशन में डिजिटल हो पाएगा, तुम लोग करना है करो, लेकिन नहीं पॉसिबल। लेकिन जो इंटेंशन गवर्नमेंट का है और जिस पॉलिसी पर ये लोग काम कर रहे हैं उसमें हमको लगता है कि अगर 3 साल का टारगेट इन्होंने दिया है कि पूरे हेल्थ इकोसिस्टम को डिजिटलाइज कर दिया जाए, तो मोर और लेस ये लोग सक्सेसफुल होंगे। क्योंकि सारे गवर्नमेंट हॉस्पिटल में आप फॉलो करेंगे तो काम शुरू हो गया है, लगभग सॉफ्टवेयर सब प्रोक्योर कर लिए हैं और सब लोग उसमें कुछ कुछ एंट्री करना शुरू कर दिए हैं। और आप एबीडीएम के इनसाइट्स के साइट पर जाइएगा तो फिर आपको पूरा उसमें दिखाएगा कि आज कितने लोगों ने आभा कार्ड, कितने हॉस्पिटल्स ने आभा कार्ड। तो ये सब काम हो रहा है, तेजी से हो रहा है। तो हम लोग को भी जितना सीखना है जरूरी है। और अगर सरकार सीखने के लिए आपको गवर्नमेंट की तरफ से कुछ पैसा इंसेंटिव भी मिल रहा है तो क्या दिक्कत है, आप सीखिए, काम सीखना जरूरी है। और ये अभी सीखिएगा तो आप बाकी लोगों से आप आगे निकलिएगा होकर। जब डिजिटल आपको मैंडेटरी हो जाएगा, जैसे अभी एनएमसी का एक एथिक्स कमेटी का रिपोर्ट आया कि आपको जेनेरिक दवा का प्रेस्क्रिप्शन मैंडेटरी है। अगर वो मैंडेटरी रह जाता तो आपको लिखने में प्रॉब्लम होता, एक एक प्रेस्क्रिप्शन को लिखने में आपको ज्यादा समय लगता। और अगर आप एक टेम्पलेट बना लिए जो इका के थ्रू बहुत आसानी से बन जाता है, तो आपका सारा चीज एक साथ आ गया। तो ये एक सीखे रहिएगा तो आगे आसानी होगी। इसके अलावा है कि सरकार के रिकॉर्ड में भी तो आप रहिएगा कि हाँ इन लोगों ने शुरू से इस प्रोजेक्ट को ये किया है। तो कल गवर्नमेंट का सारा पॉलिसी हेल्थ फॉर ऑल की तरफ जा रहा है, तो हेल्थ फॉर ऑल में आपको तो सारा डिजिटल काम करना ही होगा। हेल्थ फॉर ऑल ज्यादा दिन नहीं है, हमको लगता है कि अभी 50% पॉपुलेशन को गवर्नमेंट ने कवर कर लिया है ऑलरेडी आयुष्मान भारत के अंडर। कभी भी वो ओपीडी का सर्विस ले आएगा उसमें और आपको करना होगा सारा चीज कैशलेस में, तब फिर क्या करिएगा। ये बेसिक मॉडल एनएचए का अगर आप देखेंगे तो या तो ये यूके से का मॉडल होगा या फिर सिंगापुर का मॉडल होगा। कहीं ना कहीं से तो उस जहां जो सिस्टम वहां रन कर रहा है वो सिस्टम यहाँ भी गवर्नमेंट इम्प्लीमेंट करना चाह रही है। तो हम लोग को जितना तेजी से लर्न करें और अपने फ्रेटर्निटी में जितना लोगों को बता पाए, और उसमें जो सबसे रोबस्ट सिस्टम आपको लगे कि नहीं ये सिस्टम सबसे इजी टू स्टार्ट, तो मुझे लगा कि ये ईका का सिस्टम है जो कि इजी टू स्टार्ट है, कि कोई भी न्यू कमर इसको आसानी से यूज कर सकता है, कम से कम टाइम में टेम्पलेट बना के ये कर सकता है। सिर्फ आपका प्रेस्क्रिप्शन अपलोड का नहीं है, आप प्रेस्क्रिप्शन अपलोड करते हैं, इन्वेस्टिगेशन लिखते हैं, एक्सरे करवाते हैं, तो आप अलग अलग हेडिंग में डेट वाइज उसको ऑर्गेनाइज करके रख सकते हैं। आप ईका के फाइल ईका में जैसे ही आप उसको सेव करने जाते हैं, क्लिक किए फोटो, तो वो प्रेस्क्रिप्शन के रूप में है, लैब रिपोर्ट के रूप में है, या अदर्स के रूप में है, वो आपका ऑटोमेटिक डेट वाइज सेव होता चला जाता है। तो कल होकर आपको फिर से रिपीट देखने में भी आसानी होगी। का फिर कहीं और दिखाना चाहता है तो वो भी लगेगा कि उसको कि हाँ कहीं मेरा पेशेंट गया है तो किसी अच्छे डॉक्टर ने उसको ऑर्गेनाइज करके दिया। दूसरी बात है कि हम लोग इतना भाग दौड़ का लाइफ है, कभी कभी 50-50 पेशेंट लगातार देखना पड़ता है, तो होता है कि प्रेस्क्रिप्शन का क्वालिटी मेरा ऑटोमेटिक गिर जाता है। अब कभी वापस पेशेंट आया तो लगता है, खुद गिल्ट होता है कि ये मेरा ही लिखा हुआ है, अरे इसमें तो डायग्नोसिस भी नहीं लिखे हैं, इसमें एग्जामिनेशन भी नहीं लिखा है मेरा। और अब जब हम आप अपलोड करने जा रहे हैं किसी को, तो हमको ऑटोमेटिक वो अपना में ध्यान आएगा कि नहीं, इसको हमको एक सुंदर वे में लिखेंगे, कल होकर तीसरा डॉक्टर देखे तो वो कहे कि अप्रिशिएट करे कि नहीं, इस डॉक्टर का प्रिस्क्रिप्शन वर्दी था, ये जरूरी है। तो इससे आपका इंप्रूवमेंट होगा, डे बाय डे आपका प्रिस्क्रिप्शन का जो लिखने का तरीका है वो सब सुधार होगा। कोई टोकेगा नहीं, कोई सरकार की तरफ से कोई मेडिको लीगल एक्शन का बात नहीं हम कर रहे हैं, लेकिन अपने में सेल्फ डेवलपमेंट की बात होगी। मेरे हिसाब से इसमें जितना जल्दी पूरा का पूरा प्राइवेट सेक्टर इन्वॉल्व नहीं होगा तो फिर ये नहीं होगा, उसको नुकसान होगा लॉन्ग टर्म में फिर कोप करने में। क्योंकि कुछ दिनों में हमको लगता है कि गवर्नमेंट से मेन कंपटीशन होने वाली है प्राइवेट सेक्टर की, गवर्नमेंट और कॉर्पोरेट से। कॉर्पोरेट तो अपना सारा चीज डिजिटलाइज कर लिया है, बहुत सारा अच्छा अच्छा सिस्टम ला के आ रहा है। इवन हम देखे हैं कि ईका का ये पटना के एक हॉस्पिटल का प्रिस्क्रिप्शन हम देख रहे थे कि ईका के थ्रू वो जनरेटेड, कॉर्पोरेट का किसी कोई इंडिविजुअल डॉक्टर का हो सकता है वो, लेकिन वो था। तो इस तरह से तो वो कॉर्पोरेट भी इसको ये करेगा। और कीमत अभी आपका बाकी सॉफ्टवेयर से तुलना करिएगा तो मेरे हिसाब से बहुत चीप है। हमको लगता है कि इसको सीखने के लिए तो DHIS में जुड़ना चाहिए और अपने सेटअप को इसको इंटीग्रेट करना चाहिए, और अपने डाटा को सेव करना, मैनेज करना, इसको सीखने के लिए अगर इंसेंटिव मिल रहा है तो उसको अवेल भी करना चाहिए जितना मैक्सिमम हो सकता है। मेरे हिसाब से ये अभी समय का मांग है कि इतना जल्दी आप लोग ऑन बोर्ड हो जाए तो उतना अच्छा रहेगा।
थैंक यू सर, आपने तो एकदम बढ़िया से यू हैव लाइक समराइज्ड द होल थिंग सो ब्यूटीफुली, एंड दिस इज रियली अ मच नीडेड information that I think all of doctors we are aware of it somewhere, कहीं ना कहीं पे हमें अंदाजा है, बट वो कहते हैं ना कि हमें अंदाजा होता है बट हम इम्प्लीमेंट करने के लिए आगे पीछे सोचते हैं। So hopefully after this talk वो implementation के लिए we will be able to will get a little bit more push कि हाँ नहीं हमें implement तो करना ही चाहिए, let's go ahead with it kind of a thing. So Dr. Sanjana?
So फिर से like डॉक्टर पंकज का like real information and जो आपने बहुत अच्छी तरह से बोला है कि we want to make our prescription beautiful, but कितनी बार हम फिर से जब हम देखते हैं तो we like अरे हमने ये मिस कर लिया। ये EMR सॉफ्टवेयर आने के बाद this is one thing I think which has kind of improved the entire doctor patient relationships as well. So I would like sir.
Yeah, I would also like to say one thing, as Dr. Pankaj was rightly said, because he is practicing in area where people are not academically or educationally so well hyped, and still he took that initiative. Similar kind of experience I would like to share. Just 3 days back, I got one 73-year-old man. He has taken online appointment through Google, through Eka Care. He uploaded all his questions, his symptoms. He has uploaded all his sugar reading. He has uploaded all his medical record, and he came to me and said, "Sir, आपके पास तो सब है. Now let me know what to do." And after doing all these things, he got very good, sir. I got your prescription on my WhatsApp. I need not to have this physical copy, and I will take appointment online only next time because I found the system very good. Now a 73-year-old guy and who was just a businessman, is not that educated, but he has easy readiness to accept the change. What I feel that why we are not doing, because it is an inertia what lying between us amongst our fraternity also, as well as from patient side. So we have to come out of that inertia first. We have to make our staff ready to help our patient to be part of this thing, and then it will be successful.
Definitely, sir. I think you put it the best way. Kudos to both, all of you doctors who are actually already implementing the scheme in your setups. And again, thanks a lot for sharing your learnings and challenges, if there was any, in integrating the ABDM and DHIS into your practice, sir. If there's any more, questions or discussion, we can do it. Otherwise, we'll move on to our next session. So we now come to our next session. This is by our very own Dr. Preeti, who is our core team member with 15 plus years of clinical experience as an anesthetist and intensivist, working with health tech since 2.5 years. And she currently handles doctor success at Eka. So in this session, we will be discussing on what are the different earning opportunities under the DHIS scheme. So Dr. Preeti, over to you.
Thank you, Dr. Sanjana, for the kind introduction. Let me share my screen over here. I have a very small PPT made where I will try to walk through the various steps of the earning opportunities that we doctors have through this DHI scheme. So, Digital Health Incentive Scheme, as the name itself suggests, the government of India really wants that the entire health ecosystem per se, which is all the stakeholders of health ecosystem, be it doctors, be it the various health facilities like radiology centers or labs, the patients, the core patients themselves, all of them come in a 360-degree connected fashion with the help of tech. That was the whole premise of the ABDM scheme, as Dr. Nilesh sir and our esteemed panelists have rightly pointed it out. But in addition to that, the government decided, okay, let's incentivize our doctors so that they onboard also with much more enthusiasm, and also they upload patients' records, which is the whole idea behind it, as the doctors rightly pointed it out. Seamlessly tracking the patient's health records over a longitudinal period of time really solves a lot of time constraint concerns that we doctors in India have, and helps the patients also, because they feel the doctor has given us more time because we spend less time going through their records. So we have seen an unprecedented growth in digital health records over the past few years. But at the same time, there's a big lack, because majority of the transactions even now are in non-digital format. So there's a huge potential for further growth in this digitalization. And to boost this potential, NHA decided to incentivize all the stakeholders. All health facilities which are registered with Health Facility Register, and they can earn an incentive up to 4 crore rupees. So that health facility registers is registry, basically is a registry where all the health facilities, as I said earlier, the labs, the radiology centers, our clinics, our hospitals, the HMIS systems, all of them, they get registers. We get a HFR number. What are the benefits of digital health incentive scheme? So first is, of course, we get incentives for digitization. We doctors actually, we are pioneers and we really get to contribute to building this entire ecosystem, which is a beautiful feeling. And I think Dr. Pankaj Kumar, he has already experienced that feeling and he loves it, I'm sure about it. It increases the efficiency in healthcare delivery also by enabling the longitudinal access, as we discussed earlier. The overall thing is that it improves patients' health outcomes because of ease of access to the digitized health records. And this also improvises the healthcare deliveries towards the patients. When we see, as Dr. Piyush Desai rightly said, a 70 plus year old gentleman actually loving the whole tech flow and the journey, it basically validates that yes, this is gonna work, this is gonna help. So, how do I, as a medical practitioner, be eligible for these incentives? How do I get these incentives? So, first, we actually register our health facility on this website, and the further steps Dr. Sanjana is going to elaborate in her own presentation. So just this, a very short thing. Step 2 is we actually onboard with one of the partners who are with the government of India using their tech. Then we register for DHIS and then we log in into one government website where we can claim the incentives. So how are these incentives actually given? A lot of doctors have this query that now I have in my the health facility, I'm uploading my patients' records, I'm creating those transactions. How do I get those incentives? So government has made certain criteria. The first is that there is something called a base level transaction. That is, there is a certain threshold. Based on that threshold, you become eligible for getting these incentives. So the thresholds are dependent on the type of entity. For hospitals, clinics, and nursing homes, it is 100 transactions per month. So once we start uploading the patient's health records, for first 100 transactions, we do not get any incentive. From 101st transaction, we get 20 rupees per additional transaction on the base level. Now, these transactions would actually mean that same patient ka if multiple records are uploaded, each record is considered as a single transaction. But at the same time, only one upload per day is eligible for incentive. So if you upload, let's say 5 records, we will link them on different days. So that way, then it can be counted as different transactions. Monthly limit for this is up to 5. Same rule book applies to the diagnostic facilities, the labs, and the pharmacies as well. For digital solution companies and for insurance providers, the government of India has given certain different set of rules. Now, it is expected that this will further reduce the cost of transfer because basically this incentivization is to enable that the cost for digitization that the health facility or the doctors bear, that will be reduced by this incentives. We have this wonderful incentive calculator which is there on the Government of India web page, where the calculator already takes into account the base level of transactions, which is 100, and now we add total number of transactions. That is like we can put how many records we have uploaded on that particular month, and we get the amount immediately over here shared with us. We have this wonderful dashboard by Government of India, which is abdm.gov.in, where the entire dashboard, we can see our own progress, the different health facilities ka progress over here. Now, another thing that I would like to talk about here is there is a difference between the health facility and there is a difference between a health facility provider and a health professional registry. So let's say there is a clinic in which there are 4 doctors working. Each doctor will have their own HPR, that is health professional registry number, which will be linked to a single HFR, which is health facility registry number. All the transactions that are made, that will be made under the HFR number. The incentives will be provided for the HFR and not for the individual HPR number. That would be the further thing would be looked into by the health facility itself. So this was the brief this thing about how the incentives are given. Now another thing is that the incentives are directly given by the Government of India, and whatever is the bank account that you tend to onboard yourself with, the money will be deposited in that account directly. On Eka Care tool, again, we have, especially on the mobile, we have a tracker where we can every day see our monthly and daily how many transactions we have made and how much incentives we are eligible for. So that we can actually see on our Eka Care tool as well, on the mobile app as well. So this was in brief the incentive structure as provided by the Government of India to basically encourage us to get onboarded on the ABDM and DHIS scheme. So any questions, if anyone has now, we can answer now, or we will take it at the end of the session. So let me now hand over the session to Dr. Sanjana. She has been one of our core founding team member, and she has She has been working in the digital health space for the past 3 years now. She is a public health specialist and a diabetologist by qualification. She is also manages the digital health at Eka Care at present. So, Dr. Sanjana, over to you.
Thank you, Dr. Preeti, and for the session. I hope a lot of, so we just ran a poll. I'll let everyone know the results. So we just ran a poll about how many people have heard about the DHIS scheme before. And this, we have gotten back 63% have never heard of the DHIS scheme. So this is a good boost for us for creating this webinar. I think your session would have added a lot of knowledge to them. Now I'll just come to my part, which is how do you make your practice. So I'm sure all of us here are doctors practicing, and how do we now switch to becoming ABDM compliant or DHIS compliant? So the previous sessions from all of our esteemed panelists, we already have an idea what DHIS is and what ABDM is. So for me, at least when I initially started understanding what this ABDM was all about and DHIS, the way I see is there are three pieces in this puzzle for us doctors at least. So there is a HPR, there's a HFR, and a HMIS. So HPR is nothing but a healthcare professional registry. That is, so any doctor who wants to become part of this ABDM ecosystem first needs to register themselves under this HPR, which is nothing but a national repository of all doctors or anyone involved or any stakeholder in health, be it a doctor or a staff or a nurse, they need to get registered into HPR. That's the first step. Then, wherever we are practicing in our clinic, that needs to get registered into something called as HFR, which is nothing but Health Facility Registry. So following this, so once you have registered yourself as a doctor, then you're registering your clinic. Then comes the third piece in this puzzle, the one which brings everything together, which is your HMIs or an EMR software or a digital platform which you need to use for creating these ABDM or ABA related documents or digital records basically. So how do we go about it and what are the steps? First is get registered into the HPR, like I already mentioned. Then HFR, start using an ABDM enabled software. So there are multiple, players in this. Eka Care, like we all are very proud to say that we are one of the biggest private players when it comes to ABDM and ABA creations as such. So, and we are very closely working with NHA. So even we kind of get to know a little about upcoming policies and we get to give a lot of feedback from our practicing doctors that maybe this is not working. Something as simple as around the incentives, that the first 100 should also be considered for incentives or something where there's a conversation happening. So choose your ABDM enabled software very wisely. Then once you've gotten into the software, you need to log in and register for DHIS in your HFR profile. So I can just show that screen. So this is, like I said, all of this you can go through an EMR, go through us as Eka Care, or you can do it yourself on the website itself as well. It's all open. It's on the NHA website. So once you click on it, they'll just ask you to give certain basic details. I'll come to that in a while. Once you have registered for DHIS in your HFR profile, then as and when you're linking more digital records, you can claim incentives, which was already covered by Dr. Preeti. So how do you log in and register for DHIS? So one thing we all need to understand is for ABDM or this entire scheme, the main entity is HFR. So we need to, like, even if there are multiple doctors working in a single clinic, the scheme will always reimburse or give incentives based on the number of HFR. So what matters is the clinic. That is the standing pillar for the entire ABDM ecosystem. So what do you need? So the details are pretty basic. So for you to register as a HPR, basic things are required. What you need to keep handy is your medical registration number, your Aadhaar number, your mobile number, your email address, and when you're registering for your HFR, you need to even provide your clinic details and the address proof for it sometimes. Then Coming to the second part, where you have to register for DHIS, or you want to enroll yourself for DHIS, it's another small step where you need these four details. So, because ultimately it's an incentive scheme, you will have to give your bank details or the bank account where you would expect the incentive to be reimbursed. So, account details, cancel check. There's something called as a mandate form and an annexure form, which basically is a declaration for form of your address, clinic address, and your bank details. So this is what the whole process entails. But if you are a busy doctor and you're like, I really do not have the time to spend on these things, so that's where Eka Care comes into the picture, with or ABDM compliant softwares, where you just have to get in touch with uh, any of our team members, and this whole process is stitched in 10 minutes. So all you'll have to give is these initial details that I mentioned. So this was how you get registered into a DHIS. But what does it entail? Like, how do you start generating these digital transactions? So there are two flows for that. So this is just again a snippet from the dashboard showing how many ABBA IDs we have created. So if ABDM is the ecosystem, ABBA ID is the lifeline for it, basically. Because ABBA ID is almost like your digital health ID, just like how we have our Aadhaar for our identification. ABBA IDs is your digital health ID. So any digital record that is generated needs to be linked to an ABBA ID. And the whole goal is to create as many ABBA IDs as possible so that more and more people are getting digital in the country. So once you're in let's say you have taken up this HMIS, you have enrolled for a ABDM compliant software like Eka. So there are two options. One, we have Dr. Pankaj sir and Dr. Piyush sir who already create digital prescriptions. So they have completely become digital doctors of NHA, where they have completely moved their practice to a digital. So there's no pen and paper. But we have come across doctors who have probably not yet found the time or the whole learning curve around going from pen to paper, right? So for them, they can still use the HMIs and benefit from the DHI scheme by using a software like this for their appointment, and then retrospectively linking digital records of their patients via after creating an app ID. So I'll just be sharing a small video of both these flows, and probably if time permits, we will again go do it live as well. So this is the first video showing. So this is the Eka software. Like once you have enrolled, you have been onboarded into Eka, this is how your login page will look. So let's just start with that. In the flow, meanwhile, as we so once the patient walks in, on the software you'll start getting to see if the patient has an ABBA ID registered or not. And you can start creating ABBA IDs for your patients right then and there. And for creation of ABBA IDs, you just need one of the two things, either the patient's Aadhaar number or their mobile number. So once the Aadhaar number is there, either of these two is there, they get an OTP on their mobile, and you just need to add it to the tool, and the digital prescription or the digital record starts getting linked to that particular ABBA ID. And that's the whole purpose of it. And so this is just a video of whatever we just explained. So I'll play that again. Again, apologies for the hits. So this is how creating a digital prescription with auto ABBA works. Now going to the next other flow of, am I on mute?
No, you are audible, but when the video is being played at that time, your voice was cracking.
I will just let the video play then without talking. Probably. So
Yeah,
this, hopefully this is the last video where we don't have more hitches. So this is another flow, we just explained before. Some doctors do not have the time probably to, or they still in that process of going completely digital. So in that case, you can not or hold using the EMR for digital prescription, but you can still link medical records to an ABA ID of your patients. So I'll just show this flow, and maybe if it's not clear, we can address it during the Q&A session. The video is visible no, this time. So this is on the mobile app. So you can delegate this even to your staff or receptionist, and you probably don't have to spend extra time on this as a doctor. And so that digital ID is created, and staff can just click the photo of either the handwritten prescription or a lab report or any other medical record. And even this, the beauty of it is even this gets counted as a digital transaction. So this was how there are two ways in which you can use this DHIS scheme in your clinical practice. Either you start generating digital prescription, but ensure that every patient that you are getting into your clinic has an ABA ID created, or even if they have an existing ABA ID, you just link it. The minute you put their phone number, you get that pop up at the tool. Then just a few as a closing remarks of this particular session. How can you optimize, like what are the advantages of going for Eka kind of a software for DHIS? So first, like I showed, since there is a mobile app as well, you can use your staff. You can actually, we have a few doctors who have employed staff only for this purpose, and almost gained the salary back of that staff with additional extra incentive as well along with it, because it's just taking one person to sit in the front desk and linking the ABA ID, and whatever consultation has happened or health records that have come, they have to just link it on the app, and there is no need for an actual laptop or setup. Another is it is not compulsory to use the EMR. Like I said, you don't need to completely start generating digital prescription. Only records is also sufficient. And we have another unique way where we've identified. I think one of those questions came in the Q&A as well. Like if you have a prescription and a lab for a patient on the same day, there is some things set at the back end. So we will ensure that it is linked on two separate days. So you end up getting the incentive for it for both the records that are generated, because there is a clause in DHI that per day per patient you can link only one. So you don't even have to take that extra overhead. And overall, as a clinical doctor practicing, this becomes hardly a deterrent in your regular practice. In fact, like both our panelists mentioned, it kind of improves the overall quality as well. So this was in short about the session. Dr. Preeti, over to you.
Thank you so much, Dr. Sanjana. Amazingly informative talk. And yes, the videos and the entire recording will be shared with all our attendees. So if there were any glitches, we really apologize for the same. Let's share some ABDM DHIS success stories now. So far, 286 facilities have been linked to DHIS through the Eka Care app. And the whole process actually runs through 10 minutes. When you guys please do explore it, and you can call our executives and they'll just onboard you, and the whole process, the whole call lasts for almost 10 minutes, not more than that. So Dr. Sanjana, if you can play some of our esteemed doctors' success stories. Sanjana, you might be on mute.
Even after so many years, the challenges of technology with doctors doesn't end. I think we've almost reached to the end of the session. Now we have the Q&A. We can address those. I think the first question that we got was Dr. Virat has asked. My question is, I'm running X-ray and laboratory center. If I upload 5 different reports like RBS, HIV, CBC, malaria, chest X-ray, does it count as different records or not? And should I get incentive for all 5 reports? Doctor, actually, as per the scheme, per day, they consider one record from the patient. Only one record can be linked. Like we said, I mentioned in the PPT as well, like we at the backend can ensure in these kind of scenarios, we link this particular patient's different records on different days. But the catch is, the scheme mentions that per patient, only 5 records are considered per month. So if it's from the same patient, you can, if you're using Eka Care, you can just upload it and at the back end it's taken care of. Otherwise, if you're using any other software, you will have to somehow remember to link it on different days. But again, any single patient, any single ABA ID, only 5 records per month is considered for the incentive. I hope that answers your question. And we will be sharing all our PPTs on mail ID to all the participants. Meanwhile, as we are answering the Q&A, if Nisha, can you share the feedback Google form? We would love to know your feedback as well. We want to, have more of these and improve entire experience.
So there's a question asked by Dr. Preeti on how to get incentive. Can a doctor who's working as a consultant in other hospitals get this incentive? So if the health facility, the hospital that you're working in, if that is registered as a health facility in the ABDM as HFR, in that case, the facility does get the incentives from the government of India. So the registration of the facility remains the key in getting the incentives. So it's the facility that gets the incentives, and then it is the facility to doctor ka understanding about how the incentives get transferred to the doctors.
Okay. And then I think there are multiple questions from different specializations asking if they are eligible. I think we have a Dr. Priyesh asking if dentists are eligible for this or if pathologists are available or eligible. Definitely, you will be eligible. Like we said, HFR is what matters. If you have a clinic and if you're running any kind of health facility, it is not only restricted to allopathic medicine. Dentistry and all other alternative medicines also have benefited from the DHIS scheme. And I think we've covered. Okay, there's one question. What will be the charge Eka Care will take? So, sir, as the EMR, we don't charge for making your practice ABDM. It is kind of complementary with the EMR. For the EMR, currently the price is around 10,000 annually, and if you want to look at appointment, it is 5,000. And we will share in our mails whom you can contact for getting more these details, or if you want to book a demo, you can answer that in the feedback form as well.
I just want to add that there is no extra cut or commission basically that Eka charges on that incentive piece. So basically, that is solely between government of India and the doctor. We just charge for the software service that we provide from the Eka side.
Yes.
There's a question, how should I upload patient MRI or blood reports to Eka Care? The doctor is currently using Eka Care software, and this is asked by Dr. M. Kumar. So doctor, since you're using the Eka Care software, you can go to the medical records section, and over there an upload record icon comes. And since you're over there, we can actually access, we can ask also the patients to share their medical records with us. And if the patient has uploaded it on their Eka Care app, And if they consent and they allow sharing with their doctors, it will become visible for us on that patient profile. We as doctor also, we can either share the PDF, we can share it via email, scan and share it, or we can take photos and we can upload it for that particular patient profile. If you need any further assistance, kindly reach to us and we will schedule a training for you where we can show the whole flow in a much better fashion. So do let us know. I think
two more questions and then the rest we'll address, I think, for crunch of time. There's one question: does the scheme is the scheme enrolling new doctors now? By Dr. Jitendra, yes, sir, definitely. It's an ongoing process and it's a long process where all of us, the goal and the idea and the vision is that every doctor and the entire health ecosystem becomes digital. So, like we said, enrolling new doctors is either you can do it directly through the website, government website, or you can get in touch with us. It's almost like a 10-minute process because we know from the doctors who have been onboarded from our end, it's just a 10-minute process. We'll share whom you can, which is the number you can contact, or if you just book a demo and they'll walk you through it.
one question that is frequently asked is how much of a backdated record can we upload? So there is no limit for the backdated. No matter how old the patient record is, we can upload those records. There's no constraint for that.
Yes. Okay, and last question. I think the questions are just coming. Do you practice? There's one by Dr. Saraswata. Do you provide image storage facilities for radiologists? So the EMR as such has a limit of how much medical record can be stored. If you're taking the EMR against each patient, you can definitely use the storage provided as per the whatever the EMR is providing. Exact space and whatever GBs that will be provided, I think one of our team members will be able to get in touch with you directly and clarify that. Okay. Dr. Preeti, shall we close it now then?
Yes, definitely. So thank you, Dr. Piyush, Dr. Pankaj, for joining us and giving us your wonderful insights, learnings, and experience around this. Thank you, Dr. Nilesh, sir, for the wonderful guidance around the ABDM ecosystem that you have provided. And thank you, Dr. Sanjana, for holding this whole through from the beginning till now. And please give some closing statements over here.
Yes, thank you again, Dr. Preeti. We have been in the digital space for now, but as I was saying, like when the video is not working, how tensed we get. I think I can imagine how hard it is for a clinical practicing doctor to feel like, "Arey, patient aa gaya, like what do I struggle with my EMR and digital tool?" But as personal use cases as well, we can at least tell from all of us in the panel that we have all used it, and now we cannot imagine a time without it. Just like how UPI payments, like this is the UPI moment for healthcare, in my opinion, in our opinion. So let's continue transforming healthcare, all of us together, especially as doctor communities will form the backbone of this. So one ABBA ID at a time. Let's do it. Thank you.
Thank you. Thank you, everyone.
Thank you.